Welcome to What Makes Up Your Mind? Updates from the frontiers of neuroscience, well-being, and mental health from the Department of Psychiatry and Behavioral Sciences at Stanford University's School of Medicine. This is your invitation to meet the faculty dedicated to understanding our most complex organ, committed to curing mental illness, and inspired to help create a healthier, thriving world. Welcome to this mini pod in our CNI-X mini series on what makes up your mind. I'm Jane McMillan. In our full podcast with CNI-X program manager, Dr. Laura Turner Essel, you learned all about the clinical neuroscience immersion experience from the Stanford Department of Psychiatry and Behavioral Sciences. They're 2-week summer programs for high school students offering exceptional access to some of the world's best researchers and practitioners in brain-mind science. Stanford Psychiatry Clinical Associate Professor Dr. Kristin Raj introduces participants to cutting-edge treatments for psychiatric conditions which haven't responded to traditional psychotherapy or medications. As Chief of Interventional Psychiatry and co-chief of the Mood Disorder section, Dr. Raj shares her experience in the use of treatments like Electroconvulsive Therapy, or ECT, and Transcranial Magnetic Stimulation, TMS, to tackle an array of tough mental illness symptoms, easing suffering and making life better for patients. Dr. Raj is also the Director of Education for Interventional Psychiatry. She manages the education of residents in these therapies. With all of her teaching, research, and treating patients, interacting with the high school students in the CNI-X program is an experience she says she relishes. Hear why, as Dr. Laura Turner Essel joins me to introduce you to Dr. Kristin Raj.
Well, Dr. Raj, you are always one of our favorite presenters at CNI-X and typically present on this idea of interventional psychiatry. So how about you tell us a little bit about that, this area of research and practice? Why do you think it's so cool, and why do you like to share it with our participants in the program?
Interventional psychiatry, I think, is kind of growing in people's recognition of it, but it's still a pretty new area within psychiatry. So I really love getting to talk to the students about, well, it's really all these things that we consider to be really basically interventions within psychiatry. So we have medications, we have psychotherapy, and then we have this group of things where we actually apply procedures with patients like electroconvulsive therapy, transcranial magnetic stimulation, ketamine infusions, deep brain stimulation. It's exciting to get to talk about those things because sometimes people hear about it in the media or in various movies, or maybe they see a research headline pop across their news feed. And I really like kind of delving into what are the basics behind that. Like, let's all start with a really good foundation of what that means, and also think about where things are headed within that field.
How do you actually present it to the students? I'm assuming they want to see things and really get into it. So how do you present to them these interventions that are so new and cutting edge?
Yeah, I try to do a lot of visuals, have some pictures, kind of describe the way that I think about using them as a psychiatrist, but also show some snippets of videos so that people really see, oh, like this is what it looks like when a patient gets treated with electroconvulsive therapy, or this is what it looks like in practice when you're using a transcranial magnetic stimulation wand or magnet with people, and what that actually looks like with an individual. So I think the visuals are really fun to discuss and show with students too.
I know that they get really excited thinking about especially those technological interventions and talking about some of the issues that go along with that. As you mentioned, some of the kind of assumptions or perceptions that people might have versus the reality. Can you think of any interesting concerns that students have had over the years that you were able to address and you feel like maybe debunk some of the myths that people might have about interventional psychiatry?
Oh, yeah. Honestly, doing this course with them, like teaching this class is probably my favorite class that I teach all year long. And I teach a lot of residents and I teach a lot. And I think that the students here are just so excited and engaged and asking questions like you're bringing up. They're asking really thoughtful questions. And it's really fun to hear what they're wondering about and talk about it with them. And I always just really like fielding questions during the whole course of the hour because people are really spot on with the things that they're thinking about. And I think it really like deepens and enriches the discussion that we have. So a couple of things that come to mind are people are kind of wondering about if we're modulating the brain, if we're doing these interventions, what does that really mean for a person? Are we changing their personality? Are we changing their ability to think for themselves? And it's a great question. And it's the sort of thing that we grapple with as psychiatrists, actually, with everything that we do. And so, kind of expanding that question out beyond just interventions, but thinking, are we changing people when we do psychotherapy? Are we changing people when we use medications? I think it's a really broadly applicable question within any time we're trying to help people think about their brain and think about the way that they think. But then also kind of talking about specifically within interventional psychiatry, either with TMS or ECT, we actually aren't impeding someone's ability to be themselves. And in fact, we're trying to really help their brain return from a space of illness or a space of being symptomatic to a space where their brain is really operating at its best, operating the way that they really feel like who they are as a person and getting back to that versus changing who they are.
And it gets into this area of neuroethics, which is research that we've conducted at Stanford as well in the psychiatry department, just looking at what are some of the ethical considerations when you are engaging in some of this innovative neuroscience practice and clinical work.
Yeah.
When you begin a presentation with a whole new group, what is it that you hope they take away at the end? Because I'm sure each group has a different community feel to it. There are probably interests, curiosity, maybe about their own future, maybe about their own mental health. What do you want them to take away? And to follow up with that, what do you take away? You teach so many classes, you practice. So from high school students, what do you take away from this? But let's start with them. What do you want them to take away?
Those are great questions. It is one of my favorite parts also at the end, getting feedback from them about the things that they do take away from the course. And I'm always just really impressed and fascinated by how much they learn and take away from 1 hour. But even beyond the kind of facts and the things that we talk about within that hour, I think this sort of bigger idea that you're kind of alluding to, like a curiosity about mental health, about interventions, about the direction psychiatry is going, about the possibilities out there with what we can do to help improve people's mental health, the possibilities that exist with TMS. And while we can treat maybe 3 disorders or 4 disorders currently with TMS, what else is out there? How can we manipulate these circuits? What are the possibilities within that? That I think is just that real curiosity and being able to see, oh, I can have these questions and have some answers to my questions, and yet there's even more questions that I have after I hear that. That's what I really love to see with them. And then for me, I kind of take away this renewed enthusiasm for teaching after every time. And it's easy for us to kind of get siloed with seeing patients and doing administrative things and get really kind of nose to the wheel or whatever that saying is. But seeing their enthusiasm for it and their curiosity, and they're always just really appreciative too, which always feels really good. So it's so nice to be able to just invest that time with them and see how excited they are to learn about it. It makes me really excited to teach.
Oh, well, that's great to hear. And I think the feeling is mutual because we hear from students that one of the things they love about you and about all of our presenters is just the passion that you all have for your work. And they pick up on that and it really rubs off on them. I'm wondering why you think young people should sign up for the CNI-X program and come learn about potential career pathways such as psychiatry and other mental health professions.
Yeah, I think at least in the feedback I've seen that people get so much out of it when they sign up for the program and do it, both in terms of the content that they get to be curious about, ask questions about, learn about. Also, just having this group of other students who they're with and doing small groups with and learning from, it seems like they really learn as much from each other as they do from the lectures. And then it seems like they get really great mentorship too from the student leader groups. And those mentors also are always so curious too, and are often kind of contacting me about their career paths. And so I think kind of having that near peer connection with the mentors has seemed really helpful and beneficial for them too.
Yeah, absolutely. Those are the two pieces of feedback that we consistently receive every year from participants. It's just that their favorite things are the contact with faculty and the contact with the mentors. And they don't expect that going into the program, but it ends up being one of their more powerful connections that they walk away with, because they can kind of look ahead and see the roadmap. They see the undergrads who are their staff mentors that they work with every day in their small groups. And then they can look beyond that and see the faculty who obviously are further along in their academic and professional journey, but kind of started out in those same seats. And so it's pretty cool progression there as far as just developmental process.
Yeah, absolutely. I think if we're only seeing someone who's, been practicing medicine for 8, 10, 15 years, it's hard to see really how you get there. But seeing those mentors like in that in-between position and kind of what you're saying, like that path along the way and people in each of those roles, I think is really cool.
It also sounds like it's just fun, the interaction between all of you. It just sounds fun.
Yeah.
We try to keep it that way. That is one of the benefits of a summer program. I feel like it's more informal than school, but it's a little more serious than summer camp. So, we try to keep it light, but also meaningful and chock full of great information, like the info that Dr. Raj brings us.
Dr. Kristin Raj, Clinical Associate Professor of Psychiatry and Behavioral Sciences at Stanford, Chief of Interventional Psychiatry, Co-Chief of the Mood Disorders Section, and Director of Education for Interventional Psychiatry. Dr. Raj is one of the dozens of neuroscience experts CNI-X participants interact with and learn from. Meet some of the others in our What Makes Up Your Mind CNI-X mini-series. And check our podcast notes for links to more on Dr. Raj's work and for the CNI-X program and application. With CNI-X Program Manager, Dr. Laura Turner-Essel, I'm Jane McMillan on What Makes Up Your Mind. You've been listening to What Makes Up Your Mind. Updates from the frontiers of neuroscience, well-being, and mental health from the experts in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. For more information on this program and all of our transformational work, visit us at med.stanford.edu/psychiatry. What Makes Up Your Mind? Updates from the frontiers of neuroscience, well-being, and mental health is a production of the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine, a copyright of the Board of Trustees of Stanford University.